This is Dateline Wyoming, a public affairs presentation of WyoRadio, sponsored by Northern Title. Good deeds done every day. Presented every Sunday at this time, highlighting issues and events that shape our lives here in Southwest Wyoming. Conversations with the people behind the headlines. Views expressed on this program are not necessarily those of WyoRadio ownership, management, or our sponsors. Time will be available for responsible dissenting opinion. And now here's your host for Dateline Wyoming, Tom Ellis.
The month of September is Suicide Prevention Awareness Month, and beginning Monday, September 19th, we will observe locally Suicide Prevention Week. This week, Dateline Wyoming continues our series on this very serious issue in our society today. Suicide, a permanent solution for a temporary problem. Each year, suicide in the United States is the cause of more deaths than homicide. Suicide is relevant to almost everyone. The problem touches people of all ages, and most people know someone who has committed suicide. To help understand the issue, Dateline Wyoming continues this week, the second in our three-part series on the subject. Our guests in studio are Cassandra Crumpton of the Prevention Management Organization and Bernadine Craft, Chair of the Wyoming Episcopal Diocese Task Force for Suicide Awareness and Prevention, discussing local resources available for suicide prevention and the way in which public and social policy affect this issue. Part 2 of our three-part series is coming up right after this message from Northern Title.
Remember when your word and a handshake sealed the deal?
Those were the days.
It's just not the same anymore, but Northern Title Company exemplifies professionalism and old-school customer service. You have a choice when it comes to title work. Northern Title makes it simple for you. They know how important it is to have everything in order. Walk away with confidence knowing Marianne and her staff have completed your title work thoroughly. Visit Northern Title Company, 2620 Commercial Way. Good deeds done daily.
Cassie, tell us a little bit about what your organization does and what your resources are on that issue.
I'm really lucky to work for a statewide nonprofit that has a community or county-based office across every county, 23 counties. And one of our focus areas that we're talking about today is suicide prevention. So we are able to receive grant monies to do community-based intervention around the topic of suicide. So my biggest task is to provide training and education and connect resources to community members to support the community and prevent lives lost to suicide.
Okay, so your organization is funded by the state?
It is federal tobacco grant settlement monies that is distributed through the Wyoming Department of Health. Our nonprofit is largely funded by federal monies, but we do receive some state funds to assist in statewide prevention across Wyoming.
What are the services that you actually offer through your organization?
What we do largely is build capacity in the community, and that sounds really funny and lofty, but we utilize our time and funds to build networks around different interventions in the community. It's an environmental change that we're seeking. We provide trainers in different areas for suicide prevention, evidence-based trainings like question, persuade, refer, in harm's way, applied suicide intervention skills training, things like that. So we can continue to educate and push awareness and increase education on the topic of suicide throughout the community.
In a nutshell, you're doing training in communications and education?
Yes, sir. And a lot of it is kind of filling gaps in the system as well. So where people aren't aware of resources or programs, filling them in and bringing them in so everybody can play nice in the sandbox to increase participation.
Do you coordinate with other organizations in that effort?
Yes, sir. We try very hard to.
Give us an idea of what other organizations you're reaching out to, you're partnering with.
We work a lot with various religious affiliations, churches. We work with the school districts, with large employers like the mines and the power plants. We work with youth organizations, Department of Family Services, probation and parole's involved. Suicide is everyone's business. Suicide prevention is everyone's business. And we work really hard to bring everybody together to be a collaborative and strong partner to prevent more lives lost to suicide.
Of course, September is Suicide Prevention Month.
Yes, sir.
And I understand you have a number of activities planned for the month.
As PMO, we've partnered with local survivors of loss and attempt survivors in our local Sweetwater County Suicide Prevention Coalition to receive proclamations from Rock Springs City Council, Green River City Council, and Sweetwater County Commissioners. So that's one thing we have going. We're also doing a collaborative partnership with tattoo shops in Rock Springs to promote awareness and education of suicide prevention and support of survivors of loss through specials that the various shops will be running after they've all received Question, Persuade, Refer training. I'm really excited about that. That's a whole new cross-section of the public that has been missed. So we're really trying to reach people at every level and support them with what they have going on.
Bernadine?
One of the partners that's partnered actually statewide with PMO is the Episcopal Diocese of Wyoming. 3 years ago, our bishop decided that this was a horrific problem statewide. Wyoming is always consistently in the top 5 for a number of suicides. It's an unfortunate statistic, and it's an unfortunate place for us to lead. We have commissioned a task force, which I chair, which is statewide. We have also put some funding into it, and one of the things we're happiest about is our partnership with PMO. We're partnered with them statewide. They provide a lot of the training, and we're partnered with them for this Suicide Prevention Awareness Week. I want Cassie to talk more about Suicide Prevention Awareness Week, but I wanted to kind of chime in with what we're kicking off with on September 19th. And that is a performance at the Actors Mission down at the Elks Lodge in Rock Springs, and it's a performance of a play called Chimes. It was written by a local playwright, Donovan Rawlings. It was commissioned by the Episcopal Diocese, and it is a one-act play addressing suicide awareness and prevention. It deals with some of the issues we talk about all of the time, some of the things that lead people to attempt suicide, some of the reasons people don't seek help, but it does so in a very graphic, very dramatic way. So we're going to be presenting that at 7 o'clock on September 19th to kick off our Suicide Prevention Awareness Week. It follows with a question and answer. We'll have some refreshments, and we'll be those of us in the cast will be speaking not only as our character, but also as some of the roles that we play in trying to promote suicide prevention.
Cassie, I know you're interested in some of the social implications and some of the acceptance or rejection, as it were, that we've seen on because of suicide over the years.
Yes, sir. It's a very interesting topic with the community because people do very much enter into the conversation with preconceived notions and expectations of the topic. One of the things that we try really hard to do is to make it a normal part of conversation, to not let suicide be the boogeyman anymore, and to make it approachable. One of the unique things about Wyoming is that we do have this really great cowboy out culture. And it works in two ways. You help one another out, but we also need to add in it's okay to take care of yourself as well. It's really important that people understand that the topic of suicide is not something to be afraid of, and you're not alone in your struggles or in your losses, and that it's okay to get help. And that's something we work really hard to pull community members together and to understand and to grow in our county. We don't want surviving family members to feel like they're on an island alone. We're a community of support, and people deserve support no matter how their loved one dies. And it's okay to have a safe conversation about suicide and offer people support in those situations.
One of the things that I came into this whole topic thinking one of the prime topics is teen suicide. However, as much of an importance as that is, it's not really the large numbers of suicides that we see, is it?
Generally, the public perceives youth suicide as being the primary demographic that's impacted. And the reality of it is, across the state, middle-aged white men are the largest group who are dying by suicide across the state. And it's always really surprising, but whenever you consider a state that is largely populated by middle-aged white men and where a lot of industry employs middle-aged white men, things like economic decline and the culture of, hey, pull yourself up by the bootstraps really has a large impact on that group.
We're talking about per capita statistics, are we not?
Yes, sir. That's how the data is gathered and compared to other states across the U.S. Wyoming is unique in that way as well. It's hard to look at our numbers per 100,000 when our population is only averaging 530,000 for the entire state. But if you remove that from it and say last year 120 people died by suicide in the state of Wyoming, that's comparable to an entire community like Opal being lost every year. It's communities of people we're losing to suicide on a regular basis.
So what are the trends?
We're actually decreasing. We've gone from first to third place in the country. We're still in the top 5, but we're decreasing. And one of the things we're trying really hard to help PMO with is they have a wonderful goal, and it's to train 10% of our population in Wyoming in a basic suicide prevention awareness techniques and strategies for everyone by, I believe it's 2017. Am I right? And we're making some inroads in that. And that's one of the things that we're trying to help with our Suicide Prevention and Awareness Task Force is we have feelers in every single community in the state. PMO can touch every county. We can touch every community. So we've really partnered to try to offer this training because that's where we hear a lot of times people don't seek help because they're afraid to ask, because they don't think they need to, because there's a stigma, or because they don't know who to ask. And then they do approach somebody and that person is terrified because they don't know how to respond. So the QPR training that Cassie has been mentioning stands for Question, Persuade, Refer. And it gives anybody, any layperson, some basic skills on how to address the issue and how to talk with someone who's maybe contemplating or who has reached out. So we're thinking through partnerships, helping to decrease it. We've dropped down. We're hoping we can keep dropping even further as we keep training more and more of our population.
Talk, if you would, just a little bit more about the Question, Respond, Refer protocol.
The Question, Persuade, Refer was developed by the QPR Institute by Dr. Paul Quinnett out of Washington State. He recognized that medical providers like EMS or the general public has been trained in techniques like CPR as an intervention until the pros get on the scene. He developed QPR to follow that model to be a simple 3-step process, but for mental health. They call it a basic gatekeeper training. It teaches people how to recognize signs of a potential suicide crisis, how to learn how to ask the question if somebody is in a suicide crisis, how to persuade someone to live, and then how to refer them to help. And that referral process includes local and national resources. And it's really empowering people to get involved and take the lead and intervene in a potential crisis in an effort to offer positive hope and save a life.
That would seem to be important information for anybody, whether it's law enforcement or a family member or just an acquaintance in many of those cases, to be able to have that information and be comfortable with it.
Yes, sir. And it's a really important part of the education piece as well, and breaking down that stigma. Once people realize it's not a scary topic, if you know the basics to be able to involve yourself in, and whenever you have the support to ask the question safely and a system for that referral process, it really does eliminate a lot of the fears that people have before engaging in the training.
Dateline continues after this message from our sponsor.
When you buy or sell a house or property, you have a choice in real estate agents. When you're ready to close on that real estate transaction, you also have a choice in your closing company. Northern Title has been servicing Sweetwater County for many years. Their experience can make your closing time quick and hassle-free. So tell your real estate agent your choice at closing time is Northern Title, 2620 Commercial Way, Rock Springs. Good deeds done daily. Northern Title.
We now continue with Dateline Wyoming. How does Sweetwater County stack up as far as having resources to deal with that?
I think in Sweetwater, we're fairly lucky to have a large number of providers in our community compared to some of the outlying areas or the smaller counties. we kind of have a lot going on compared to many people. And I think a lot of times people just don't realize that those resources exist. So we work really hard to kind of promote and collaborate and have everybody work together.
And it's one reason why we're trying to partner so much, is to really guarantee that. And I will tell you, we're talking about like the QPR training being the gatekeeper training. And what we're hearing about in some of these tiny little communities is, I'm the only one there. I'm it. I have nobody to refer to, which is a very specialized program that we're dealing with in other areas. But we're lucky. We're very lucky. We're extremely lucky to have the PMO staff that we have here. Cassie is doing a wonderful job in creating partnerships that are really geared to address this problem. So I think Sweetwater can be proud of themselves. Sweetwater County, unfortunately, in years past, has led the state in suicides completed, which means that we have been number one in a state that was number one, which is not a place we want to aspire to. That's not the case anymore. And I think it's due in great measure to the number of partners working together to address this problem.
Does Sweetwater kind of reflect the other counties in the state as far as the statewide situation?
It does, but we really do have additional services. And of course, one of the things, and I might switch hats really quickly, but one of the things that has concerned me as a legislator is that right at the time when people need assistance most, at a time when our state revenues are declining and people are feeling helpless, they're feeling hopeless, we have cut our resources to PMO and to other prevention and awareness programs and to other behavioral health programs throughout the state. Right when we need to be providing services for our citizens, they're being lessened, if you will, which is hard for a lot of communities. One of the things that we're looking at that's kind of an offshoot is we're seeing people lose their jobs, go off their medication because they think they can't afford it because they've lost their insurance. And we had a couple of instances in other counties throughout the state where folks off their meds ended up taking their own life and attempting to take other lives. Almost every pharmaceutical company in the United States has drug prescription plans where they will make medication available. People don't know that. So that's one of the things we're working on, is trying to get information like that out there to everyone in whether it's pharmacies, doctors' offices, schools, library, wherever it might be, so that people know that help is available there. So in looking at the statewide level, I'm concerned because it's like our safety net is not as wide as it is. That's another place where Sweetwater is lucky because PMO has had to reduce funding and reduce employees in other parts of the state. So we've got a death grip on Cassie here, and we intend to keep her.
So I understand that Wyoming was really in the forefront of legislation impacting suicide and these social issues.
Right, the Jason Flatt Act, and we're very, very proud of that.
Talk a little bit about that, if you will.
That basically mandates that anyone working in the public schools complete suicide prevention and awareness training. So it's a state mandate. Schools can't get out of it. And one of the things that is accepted as proper training for this suicide awareness and prevention is the QPR training. And it's another thing that we're going to offer during our Suicide Prevention Awareness Week is on Wednesday of that week up at Western Wyoming, Cassie is going to be doing 3 different sessions of QPR training. So anybody out there, and I would really encourage people who are working in our school districts, this will satisfy that requirement.
QPR is?
Question, persuade, refer.
Going forward, what would you like to see in terms of perhaps new programs or increased programs? Or what do we need to do? What can we as a community do, as a county do, as a state do, in order to address it?
I want all programs that will help our people. Honestly, if I could have a pie in the sky, it would be enough funding to support everybody in every way they needed it in terms of programming. But I think a real call to action for the general public and the community first is to get involved and to get educated with the possible training. Also speak with their elected officials. And that's not just on a state level, at every level. Get involved. Tell them what matters to you and your family, because they listen. And they have the ability to decide where the funds go to support different things. And it's really the community that drives that more than any one person or agency.
This is really an issue that touches everybody at some point.
Yes, sir.
Yes, Cassie's absolutely right. I don't think I know anybody whose life hasn't been touched in one way or another by a suicide. That's one thing that we know is the ripple effect that happens when a suicide is attempted, and even more so when one is completed. It really is community working in partnership and cooperation, not reinventing the wheel with lots of different kinds of things, but a solid, united front. And unfortunately, we know state revenues are going to continue to decline. I'm told it's going to get worse before it gets better. That's very, very scary. And it does mean that we have to unite, and we may have to pool not only our talents, but our resources in addressing this issue.
One of the things that we talked about was just the social stigma. And that would indicate more education, more communications. Where do we go with that?
I think a good first step is just starting to let people know what is already available and who it's appropriate for. We have 3 different levels of suicide prevention training that happen within our community already. One is the QPR, the gatekeeper. The Applied Suicide Intervention Skills Training, or ASSIST, is a little bit higher level than that. And we have a representative with Southwest Counseling that teaches AMSR. I don't know the acronym for that one, but it's a very high level counseling kind of certification specifically on suicide for counseling professionals. I mean, even in Sweetwater, we're home to that already. So just finding a place for people to fit and what is applicable in their life would be a really good start.
Let's talk about some resources available. If someone knows someone or is concerned about someone, what are the steps they should take? Who should they call? Where can they go?
There's a few different things that are available locally. Southwest Counseling does have a 24-hour hotline that is answered by a licensed counselor at any time. Sometimes people aren't really comfortable with having a local connection and they want the ability to be a little bit more anonymous. We really encourage the National Suicide Prevention Hotline. That's 1-800-273-TALK, T-A-L-K, 8255. That's national. It's free, 24/7. It's answered. We also are really proud to promote and support the Trevor Project. It's an LGBTQ crisis hotline, specifically for that population. It's really good. That's 1-866-488-7386. That's a really important crisis hotline that reaches a lot of people. There's also a veterans crisis specific hotline that is popular as well. So these are for the people that may not be comfortable connecting to someone who may know them or their family or their specific story, and they're manned 24/7. And it's a good starting point for resources for that immediate crisis. And then we recommend a follow up with a local mental health provider.
And of course, those are all set up to be totally anonymous.
Yes, sir. Yes, sir. They are. And there's even crisis text hotlines for youth.
If someone is out there listening and they have a group or they have somebody that they would like to have the training, how can they contact you?
Oh, call me.
Phone number.
We are 389-7364. That is my work cell phone. If I don't answer, please leave me a message. I will be there at 4 a.m. at your location if that's what you need, and I'll even bring donuts. I'll make it happen. It's a good 2-hour training. It's really informative, and we'll make it fit just about any environment it's needed in.
Bernadine, any final thoughts?
Well, I really appreciate you having us on, Tom. This is an extremely important issue. And I'm just so proud of Sweetwater County and how they're coalescing. And I think we can continue to do this. By all means, access the available resources. Cassie gave some contact information. I know that they can access her directly. They can access some of these other organizations. Do come. We've got some great things for Suicide Prevention Awareness Week. We talked about the play. We talked about QPR. On that Tuesday, we're going to have an open mic night up at the college. On the Thursday, we're going to have something called Inspired by Life and Inspired for Life. And that will be one of the fun paint parties that will be going on at the Episcopal Church of the Holy Communion Parish Hall. I understand they're not going to paint with wine, but there might be some wine involved. And then on that Friday is the whole big wrap-up. It's the Suicide Prevention Glow. The Walk for Life that will be on the walking track at the Western Wyoming College campus from 8 o'clock to 9:30 p.m. I really hope the whole community will come out for at least one of those events and show their support, and don't ever, ever hesitate to ask, because it's only with cooperation and communication that we can ever succeed in this problem.
Is there a website available?
We have a local Sweetwater PMO page at sweetwaterpmo.org. We have a resource sheet list on there as well that we'll be adding all this to. We also have a Facebook page called Sweetwater County Prevention, to where we keep pretty updated with resources and activities and things like that.
With that, I thank you, Cassie and Bernadine, for coming in this morning.
Thank you so much.
Thank you very much.
We'll be back after this message from our sponsor to tell you what's coming up on Dateline Wyoming next week.
Northern Title Company knows that most of us don't like paying capital gains tax every time we buy or sell property. We want to keep what we've worked so hard to acquire, but we may not know how or where to find the answers we need. That's why using Northern Title, an experienced and qualified title company, is the answer. Stop in today at 2620 Commercial Way in Rock Springs. Northern Title Company. Good deeds done daily.
You've been listening to Dateline Wyoming with your host, Tom Ellis. Dateline Wyoming is a public affairs presentation of WyoRadio News, presented every Sunday at this time, highlighting community issues and events that shape our lives here in Southwest Wyoming. Views expressed on this program are not necessarily those of WyoRadio ownership management or our sponsors. Time will be available for responsible dissenting opinion. Dateline Wyoming programs are made possible by a sponsorship of Northern Title, doing good deeds every day. Audio copies of this program will be available each Monday, following the program's airtime on Sunday at youtube.com/WyoRadio.